for 5 minutes.
Thank you, Mr. Chairman. Dr. Grabowski, was it a bat to a pangolin to a hippopotamus to Joe Rogan and Aaron Rodgers, or did COVID start in a lab? Dr. Fauci and Dr. Collins say it's the former. They said it was animal to human. Some of the virologists who they've given our tax dollars to over the years have said the same, although initially, I think it's interesting to point out, before they had their conference call with Dr. Fauci and Dr. Collins on February the 2nd, on January 31st, 2020, Dr. Christian Anderson, who's received a number of our tax dollars over the years, said virus looks engineered, virus not consistent with evolutionary theory. Dr. Gary said it's easy to do this in a lab. They, of course, changed their position after they had this famous conference call with Dr. Collins and Dr. Fauci. I was just wondering what you think. Did it start in a lab, or was it from a bat to a pangolin to a person?
So I'm a health economist. My research has been focused on nursing homes, supporting staff, supporting residents.
You got a degree. I saw your background. You got a degree from Duke, degree from Chicago. You're professor of healthcare policy at Harvard. Is it a good idea for the guys in charge of our government policy on this to mislead the American people?
So I don't have an opinion on where the virus started.
Just last week, Dr. Redfield was interviewed, and Dr. Redfield said this: Fauci knew he was misleading the Congress and the country. Do you agree with Dr. Redfield, or do you think Dr. Fauci was telling us the truth?
Once again, I don't have an opinion on this. This is sort of outside the scope of my research.
When government said the vaccinated couldn't get the virus, were they guessing or lying?
Once again, this is sort of outside the scope of what I focus on. I'm really focused on the care of our nursing home residents.
Yeah, but you're a smart guy. You're a professor at the Harvard University School of Medicine.
And I'm a smart guy that chooses to focus on nursing homes and really supporting those.
Well, how about this question?
And putting better nursing home policies in place to really provide better care for our residents and our staff.
Can the vaccinated get the virus?
Sorry, ask that
Can the
again.
vaccinated get the virus?
Did individuals who are vaccinated get COVID?
Can they get it? Yeah.
Sure.
Sure, they can. So when the government told us that they couldn't, were they guessing or lying?
Once again, that's sort of outside the scope of
How about this one? Is the pandemic over?
Once again, that's not for someone in my position. I'm a health economist whose research focuses on nursing homes.
Yeah, but you're in front of the Select Committee on Coronavirus. I mean, we talked about the number that I think you cited. Representative Scalise cited this as well. I think it was 172,000 individuals in nursing homes lost their lives. We're talking about health care policy. One of the things it seems we should be getting to the bottom of is how did this thing start? You're a witness in front of the committee with this background, educated guy, professor of health care policy at Harvard. I'm just asking you something. The President of the United States seems to think the pandemic is over. I'm asking, do you think the pandemic's over?
Once again, this is a hearing about nursing homes. I'm really focused on how do we support our staff and how do we support our residents. And
we might not have had the terrible things happen in nursing homes if the government would have been square with us from the get-go. That's one of the things I think is important for the country to understand. Maybe some of these terrible things don't happen. In fact, we've had testimony in front of this committee that said if they would have focused on the idea that this came from a lab, and I asked Dr. Giroir, I said, would that have changed how we dealt with the virus, and could that have saved lives? And he said, yes, it would have. So that's why we're asking the question. That's why it's important to the American people. And frankly, just on a fundamental level, it's important that the government not mislead its citizens, which it obviously seems they're doing. So maybe I'll ask it this way now. If the pandemic's over because the president has said it just a couple days ago, and the government misled us on the origin of the virus, seems pretty obvious they did. They definitely misled us on the statement that the vaccinated couldn't get it or transmit it. Should people who lost their job be able to get it back?
Once again, that's kind of outside the scope of kind of what I research.
Recruitment levels for our military are off 40%. I just talked to colleagues on the House floor who say for the first time in their time as a member of Congress, where they didn't have as many people apply to go into our academies because of the vaccine mandate that's on. I'm just asking the basic question, should people, healthcare policy, this seems to have a bearing on overall policy, should people who lost their job be able to get it back, particularly in the United States military?
So my research hasn't focused on kind of job loss in the military. That's really kind of outside the area that I study. Once again, I'm very focused on nursing homes, which is the focus of this hearing.
How about this one? Should Pfizer, J&J, Moderna have to pay the back salary of people who lost their job, seeing how they've been misled on the effectiveness of this vaccine?
Once again, that's not an issue that I've focused on in my research.
Mr. Chairman, I yield back.
I thank the gentleman for yielding back. The chair now recognizes Mr. Foster for 5 minutes.